very advanced in exploiting all of those most recent modalities to better understand cancer, in that case, women's cancer, so uterine cancer or breast cancer, which, despite our best efforts for many, many decades, we're still short of answers for many women. And we're really hoping that by combining those modalities, by getting to a deeper understanding at the cellular level of what's going on, we'll finally be able to crack, for example, triple-negative breast cancers or some of the, again, more advanced cancers that today we don't have good solutions for.
As well as cells and genomics and imaging, I mean, there are other data sources that the AI can bring into the equation here as well, right?
Absolutely. And I think that's also one of the secret.
The Truth Social post about if you ask questions, you're with the Democrats, and this is all a Democrat made-up hoax, and you're just idiots. When all his surrogates had promised they'd bring this out, he talked about bringing it out. So this is Harry Carey. This is seppuku. For those that don't know, in Japanese, that means suicide. And I had the head of Rasmussen Polling on, the best polling agency, the most accurate on record today. He said Trump has lost 14 points with independents, 5 points with his main base. Like Steve Bannon said a week ago, that'll lose him before Rasmussen reported it. His dead reckoning was right. 40 seats probably in the midterms in a year and a half. This is Trump self-harming. And from all my research, he knew Epstein, there were socialites, all that, but they would have already used this, that he said they had something. The Jane Does they brought out turned out weren't even real people. They'd said that Melania was a hooker that Epstein introduced to her at a modeling agency. We looked into that. It was Trump's modeling agency. That wasn't.
Longevity, anti-aging, live forever culture that's emerged in the last couple of years.
I understand where it's coming from. We've made a lot of scientific progress. We believe that we should have the answers to the one problem that is facing all of us, and that's that life is not forever. But I feel like the field has been corrupted. And it's actually the way that healthcare has been corrupted across the board. So when we talk about health insurance, the pharma industry, anti-aging industry, a lot of it has been corrupted with capitalism. And I say that as someone who's actually pro-capitalism. But I believe healthcare is a commodity that cannot be Uberized. I love Uber. I love Lyft. I love the idea of being able to call something on demand. Doesn't quite work for healthcare. Demanding what you want for your body when you're not the expert doesn't always yield the best results. We've seen that.
I don't know, but I'm not sure if I particularly need them. So I'm not that interested.
Right. What's useful is more important than what's true.
Absolutely.
Right, and you've developed a framework of thinking about yourself and thinking about reality that's been incredibly effective for you.
Completely.
Right.
What's useful is more, you nailed it, what's useful is more important than what's true. This is an old argument of mine, but I think we discussed it in the last podcast, and I'll say it again. When I say I don't believe in depression, nobody can convince me to believe in depression. That's not a matter of discussing whether depression is real or not. That's a matter of me accepting that my mental model for going through life is more effective if I don't believe I can become a depressed person. Yeah. I don't believe in depression, so I can't be depressed, so that allows me to be more effective. It's not a matter of sitting there going, well, maybe it's true, maybe it isn't. I don't believe in it, so I can't catch it.
You shape your own reality through the conviction of your thoughts, your beliefs, and the words that you use.
Why else would you adopt any kind of mindset unless it's designed specifically to make
Thank you for jumping on a plane and coming all the way to Boston for the Mel Robbins podcast. We are thrilled that you are here.
Well, thank you so much for asking me, and I'm thrilled to be here.
So I'd like to start by having you speak directly to the person that is listening right now. And can you tell them what they may experience in their life and with their health if they listen to everything that you're about to share and they take the research back advice that you're about to give them?
Yeah, so I would say that if you take home one thing from what I'm talking about today is that the importance of facts, of evidence-based information, because that will help you advocate for yourself in the doctor's office. It'll help you figure out what you're seeing online is truth or trash, and it'll help you feel less alone with your own body if you actually know the facts about it.
Well, one of the reasons why I was so excited to talk to you, Dr. Gunter, is because you are the #1 OB-GYN that people
If you could rewind the clock a few months, I wonder if you would do anything differently.
I probably would have raised the price higher, is probably what I would have done. Why? I think healthcare prices are inelastic. I could have raised it higher and made more profits for our shareholders, which is my primary duty. And again, no one wants to say it. No one's proud of it. But, this is a capitalist society, capitalist system, and capitalist rules. And my investors expect me to maximize profits, not to minimize them or go half or go 70%, but to go to 100%.
An immoral increase, maybe, but perfectly.
It's an epidemic that's still very much raging, exacerbated by both the pandemic and illicit fentanyl, to the point that last year, nearly 70,000 people died from opioid overdoses. That is the highest annual death toll ever. And second, you may have seen a bunch of headlines recently about trials and settlements taking place around the country. There have been so many of them, it can genuinely be hard to keep track. But we want to focus on just one company tonight, Purdue Pharma, whose rollout of OxyContin arguably fueled the opioid crisis. We have talked about their relentless push to sell OxyContin before, but more material has come out in the last couple of years, including this spectacular glimpse into a 1997 motivational sales meeting for the company's drug reps. You know you make me want to sell OxyContin.
Were there any occasions where Sean offered the escorts drugs like Viagra? Ventura responded, yeah. Johnson asked, and who else besides escorts did Sean offer Viagra to? Ventura responded, he offered it to me before. Johnson asked, and what did he say about you taking Viagra? Ventura responded that it has the same effect on women, just sensitivity. Johnson asked, do you take the Viagra that he offered you? Ventura responded, I did. Johnson asked, and how did you feel? Ventura responded, sensitive and engorged. Johnson asked, did you want to take the Viagra? Ventura responded, no. I thought, no, I didn't. Johnson asked, when escorts were having trouble getting erect, what, if anything, did you observe affected their inability to get erect? Ventura said, like I said before, just the distraction of seeing Sean move around, maybe just hearing his voice. Ventura said the freak-offs were carefully choreographed, with Combs dictating
sustainable. And I think we can relieve the patients from that with the medication.
That's scary, because then we're saying like a huge percentage of the United States should be on these medications. And it's interesting to me that we're then saying that appetite needs to be controlled over the majority of the United States. Have we gone that far?
I believe so. I mean, it's predicted that by 2030, half of the US population will have obesity. Half of worldwide also will have obesity in the next decade by the WHO. So I think we've lost the perspective around food, around portions, right? When you're on this medication, you really see things differently. It's like a blindfold was removed from your eyes. You can see that we mostly were overeating, right? Food that was probably unnecessary in the amounts. So
rank the things that are going to be responsible for the destruction of the American experiment, right? Number one is the fact that we let ourselves get fatter, sicker, more depressed, more infertile at an increasing rate while bankrupting the country.
Early in my career, I consulted for Koch to ensure sugar taxes failed and soda was included in food stamp funding. I say Koch's policies are evil because I saw inside the room. The first step in the playbook was paying the NAACP plus other civil rights groups to call opponents racist. What is going on with big food, and is it making us sick?
Cancer, Alzheimer's, heart disease, obesity, autoimmune conditions, these are all going up, and they are all foodborne illnesses. And the fact that there is not clear communication about that from our medical leaders and public policy leaders, I think is the biggest scandal in America and the most dangerous scandal.